Let's go ahead and get started. Welcome, everyone. Good morning, good afternoon, good evening, wherever you are in the world. It's wonderful to have you here. We are recording this session so that people can participate asynchronously. The workshop will be available online and part of our growing archive of online webinars featuring engaged researchers all around the world. Today we have our interpreters, so if you'd like translation into Spanish or English, you can click on the world icon at the bottom of your screen. This is the third webinar in this series, which is a collaboration with the Open Society University Network. My name is Lorleen Hoyt. I'm the Executive Director of the Talwar Network of Engaged Universities. And we are a growing global coalition of 431 engaged universities in 86 countries around the world. And we have joined forces with Open Society University Network because we share a vision of uniting civically engaged universities around the world, supporting engaged researchers, and supporting students who are working with their local communities to address pressing social issues such as disease and famine and structural racism, gender oppression, climate change, political polarization. So the world is changing. There's a lot of work to be done. And this coalition is really at the heart of bringing institutions together, bringing people together, bringing communities together to address those issues and to build stronger and more prosperous communities. So I couldn't be happier to be here. This is part of our initiative called Amplifying the Voices of Engaged Researchers. And these workshops really aim to capture and share the research and the lessons that we're learning from these innovative community university partnerships. And the first several workshops that we've had have focused on work in Latin America and in Asia. And today we bring you to Sub-Saharan Africa, where we have a session entitled Tackling Barriers of Access to Basic Education in Africa. And I want to express my deep gratitude, my deep admiration for these three scholars and the work that they're doing. Personally, I adore them, and professionally, they are leading the way for so many of us, and we're just very fortunate to have them with us. And so I yield the stage to Martina, who's at the University of Pretoria in South Africa, Peter, who's at Mount Kenya University in Kenya, and Joseph at Livingstone International University in Uganda. Thank you.
All right. Yes, my name is Peter Kirira, like I've been introduced. And today I'll talk about community partnership and adoption of safe water in rural schools of Kenya. This is a preliminary report because we'll be able to give a detailed report once it is completed. There is work done within the community in a county called Laikipia County in Kenya. And those are the research members, some of them who are in the meeting today. Next slide. So to give a background, you find that schools in rural areas in Kenya lack basic water services. And some of the students, some of the pupils are used to fetch water for the households. And they have to travel very far to get this water. And the students are also required to carry water to school so that they can use that water as drinking water, water to make the classrooms habitable, because they don't have, most of them are not cemented, and also water to clean things within the school. And the fact that they have to look for water from very far means that they go to rivers, some of which are contaminated, and this results to them taking water that is not safe for drinking, and this results to waterborne illnesses. And what happens is that when these kids have waterborne illnesses, they are not able to go to school, they miss school, they don't perform well. So the cycle of poverty continues. And therefore, if we are able to ensure that these children have access to safe drinking water, we might as well also try to improve their chances of success or having good educational outcomes. The best solution, of course, is to have piped water, going to schools, going to homes, but this is not possible because of issues of poverty, issues of resource distribution. And therefore, we have to look for solutions that the communities can use because the conventional solutions that work elsewhere are not able to work in these poor communities. And because of this, we join hands with our local partner, a non-governmental organization called Partners for Care, and we're able to access water bags. And these water backpacks are intended to support or to create an environment that allows the students to access safe water. And I'll be able to explain how that happens. Next slide. Next slide, please. Yes, if you look at the image there, you find that's how a water backpack looks like. It is an innovative product. It was created by Greif company. And this product was created out of the need or out of the realization, because Greif company normally manufacture jerry cans, water jerry cans, which are used to carry chemicals for the industry. But in Africa, and I think most of the poor parts, you find those jerry cans are recycled, and they are the ones which are used for water transport, water storage. And because these jerry cans are not intended for that kind of use, they contaminate the water. And number two, they are difficult to treat or to clean inside. And therefore, this product is, as you can see, it looks like a like a backpack that we normally use, but it has some modification. It has a tap, meaning it can dispense water. So it is a poor person's water dispenser. It has also like a water backpack. It has handles where you can carry comfortably at the back, and therefore, it is easy to clean, meaning you're able to eliminate issues of contamination. In the initial stages of our project, we used to distribute these water backpacks per household, but we realized that we'll have better impact and more benefit when you go to schools, because in a classroom, we are able to deal with 40 students, unlike when you take to a homestead, where you only deal with 5 individuals or 6 individuals. So already we have distributed about many backpacks through the Partners for Care. But for this project, which was done in 2021, we were able to distribute 1,000 water backpacks, and we did this in 66 schools, which are in resource-constrained areas of Laikipia County. Next slide. And this is the area where we did our work. As you can see to your right, there's a map of Kenya, and the area where we did our work is called Marmanet Ward, which is to the northeast of that map. So we worked with the local community partners. We had to work with the schools and the school heads, education officers. We had to work with the local ward administrators. Because of the political issues, we made sure that the politicians are supporting this work, because they are the community gatekeepers and they influence even the government policy. We also had to use community health workers. And in this case, we used community health volunteers. We used school administrators so that they can support the projects, because we were giving each class a water backpack. We also had to go to talk to the parents so they can understand why we are doing this and how this intervention is going to help their children and also they can actually also see the effect it is having on them. And lastly, partners for care, I mentioned this is a non-governmental organization that we have been working closely with as a university, and that has been able even to access the water backpacks. Next slide. So in 2021, we distributed the water backpacks to primary schools. In the previous slide, we saw we did that in 61 primary schools. But other than distribution of the packs, we wanted them to make sure that they know how to use them. So we had to do training on how to use the water backpacks. Number two, also on how to treat water, because other than giving them this safe way of all this innovative products, if you put dirty water, it will come out as the dirty water. So you had to also give them skills on how to treat the water. So, and number three, also you had to show them how are you going to clean this water backpack so that whatever water that's coming out is safe to drink, and also the water, how to maintain the water backpack does not become destroyed. So we took the pupils and the teachers through a session of training, and those photos are showing some of the schools that we interacted with during that process in 2021. Next slide, please. So as part of, in talking about our research, the objectives were to determine the acceptability of water backpacks by the pupils in beneficiary institutions. Like I mentioned, they have been used to using jerry cans, and therefore wanted to know, do they accept this new innovation or this product as a better alternative? Number two, we also wanted to determine the fidelity of utilization of the water backpacks by the pupils. How well are they using these products? Are they using the right way? Number three, also the knowledge of pupils on the benefits of safe water, because our whole focus is to ensure that the pupils in those areas see the benefit of using safe water. And this is just a resource that we are using to make sure they access safe water. And the last one, also we wanted to determine the feasibility of the water backpack and water treatment in ensuring safe drinking water among pupils both in school and home and at home. Next slide. So this is research design, and so we used a mixed method. And in this case, of course, remember there was an intervention before, and therefore we wanted to evaluate or do the impact assessment. In the research plan, we conducted the cross-sectional study in 20 schools out of the 61, and we sought to answer the questions that are derived from the research objectives. Next slide, please. So we had 390 study participants who were taken through the quantitative data. In this case, we're using questionnaires, and they were recruited from the schools. And also we of course had to take them through the consenting, because we had to get ethical clearance and a license, research license from the government organization. So for the pupils, we had to get their assent because they are underage, and also consent from their teachers. We also used qualitative data. We collected this using informant interviews, that is key informant interviews and focus group discussions. And for the key informant interviews, we dealt with the education curriculum officers that represent those schools. We also dealt with senior community health volunteers from those communities. We had a public health officer and a member of the county assembly. And we had a focus group also with the teachers from the represented schools. So all this data was helpful so that we were able now to aggregate and get a good position on how our work is helping, or how the community are benefiting from this intervention. Next slide, please. So these are just a slide that shows the schools that we carried our project in. And as you can see, we we're doing almost an average of 20 per school. These are about 19 schools. These are all primary schools. We were dealing with children who are from grade 4 to grade 8. Next slide. Yes, and as I was saying, you can see the distribution of the students. The majority of the students were in grade 8. And only 3 pupils were in grade 3 participated in the quantitative element of data collection. We wanted the mature kids because they would be able to address properly all the questions that we were asking. Of course, the questionnaire was simple, so that it was prepared with the understanding that these questions are being asked to children in primary school. Next slide, please. So these are the preliminary findings. One of the things we're looking for is the frequency of water usage from the water backpack. And as you can see, majority of the pupils, that is 91%, were using the water from the water backpack daily. And this is important because it means that the product is being accepted, is being utilized. Therefore, the pupils were driving benefits from the water backpacks. Next slide. Then the level of satisfaction, we also want them to know whether the pupils were happy with the packs. Are they seeing the benefit of using the water backpacks rather than using the jerry cans? And there was a high satisfaction rate of 85% very satisfied at 6% of cumulatively. We had over 90% of satisfaction. And only the pupils indicated that were dissatisfied with the water backpack. Next slide. The other question, of course, wanted to know was about durability of the water backpacks and also the frequency of water treatment prior to consumption. Durability is important because we want a product that can be used for a long time. And as you can see from the results, most of the responses indicate that the packs are very durable. That is 68% people that packs are very durable. And the few that had issues with durability was because of the taps, which I think I'll comment in the next slide. So the water consumption was most people on a daily basis. And you can see a good number of people treated the water. But of course, we were also concerned about 27% of those who did not treat the water prior to usage. But what we realized is that other than using the water from the packs as for drinking, other students use the water bags as hand wash stations, where when they go to toilets, they come and wash their hands. So they don't see the need of treating that water. And that's why probably there's a high percentage of those who do not treat the water. We realize that these are a majority, those who are using them as a hand wash unit. Next slide. So the question of the importance of safe water at home and at school, we wanted to see the understanding of the pupils. And as you can see, majority of them were able to indicate that it is important to treat this water so that we're able to avoid diseases. So there were a myriad of answers, but the fact that the pupils are aware that if you don't treat water, you become sick, to us, that was quite fundamental. And this slide is showing that majority of them were able to identify and see the connection between illness and untreated water. And for people at this age, when they start recognizing that connection, it means we are already having a behavior change from such as a young age. Next slide. Yes, then as far as qualitative narratives are concerned, as you can see on that image, so there's a pack that is being used as a hand wash unit. And when we analyze the quantitative data, we're able to get some thematic areas, and one of them is water bag usage in storage and transport of water. And the water backpack presented advantages in portability and storage of water. And as you can see, like I mentioned, this is a poor man's water dispenser because it has a tap. So they were able to hang it on a class and then dispense water from the tap. And what this key informant, which a senior community health volunteer said, is that maybe when you carry jerry cans, that way you're using these children in schools, they can fall or get stuck. But when you use the water backpack, we're able to see that this has an advantage over the jerry cans, because the jerry cans will hurt the children. The jerry can is heavy for the kids, but this one is easier to use. Next slide. The other theme, which is in the next slide, is like for water backpack using hand washing, like I mentioned, that it plays a pivotal role in strengthening the health of pupils in schools as they provide facilities for hand washing. And this was indicated by an education curriculum officer. And I must mention that during COVID, a good number of our water backpacks were used also as hand wash units as we are supporting the government reduction of COVID cases. So they were being used as hand wash units where kids, after they visit the toilets, they pass through there, they wash their hands. This is important to reduce waterborne illnesses such as cholera that affects kids in that area of the country. Next slide. Theme number 3, there were, of course, areas of improvement. And here, like I mentioned, there are concerns about the quality of the tap. And this is something we are addressing with the people who are supplying the park. So we wanted to make sure that we capture even areas of improvement. Next slide, please. So as you can see, here we asked them what component of the park should be improved, and majority of them talked about the tap. Also, as you can see, there's also a good number who indicated none, indicating that a good number of them were happy with the park as it is, but also a majority felt that the tap can be improved so that we have better utilization of the park. Next slide. So theme number 4 is the evidence of water backpack utilization, and from the quantitative data and also from qualitative data. As you can see, this was well used by the pupils. It was well accepted, and this also came out very strongly, even from the focus group discussion. And I can read one from the teachers. As my colleague has just said, according to our school and observation, the water backpacks has helped to reduce the congestion at water points in schools. We put them in classes that there is no that congestion at the water points. Next slide. So it means even the schools appreciate this intervention. The other one was hygiene and sanitation. Like I mentioned, the kids have to fetch water from which is not very safe and from far. And when they bring them to school, now that they know they have a water backpack and it has to be treated, then we are able to improve the hygiene of this water. Theme number 6, of course, is the issue of strategies in WASH program. And in this case, our observation is that, we normally use what is called a water garden treatment of water to make it safe for drinking. But of course, we got feedback that some of the people felt that there was a change in taste. We're exploring how also to improve this, because there are other products that you can use. But this was a good feedback also from the pupils. Next slide. So these are we have picked about the 10 themes from this study. I have mentioned about 5 or 6 of them, but the other themes are also as equally as important, and they've been in the final report, but today I'm just doing a preliminary report. Next slide. So in conclusion, the school-going children from this study, we have observed that they have adopted the water backpack because they see it as a cool alternative to water storage and water usage. And I'm saying cool because they were happy that they now have water dispenser, because most of those children have never seen, they only see water dispensers when they go to towns. Now they were able to have one in the class, and they want to take water from the water dispenser, the water backpack, and this improved their chances of taking safe water. Number two, also we concluded that the majority of the pupils, they know how to use and maintain the pack. By maintenance, it means because the water backpack is supposed to be cleaned, the liner inside is supposed to be removed and cleaned. And from the study, we're able to demonstrate that they're able to do it. And this is important because it means the water inside remains clean. And number three, and this was important to us, is that the backpack has been demonstrated as a change agent in promotion of safe water drinking amongst peoples, both in school and at home. Like I mentioned, young children are agents of change. When we start changing their habits, their perception, at that age, it means even as they grow up, they'll grow up, even when they go home, they'll tell their parents they want to take safe water. And this is important, and we're able to pick this as an important conclusion from our study. The next slide. Yeah, so I want to appreciate the research team. I know some of them are in the meeting. We have some from Mount Kenya University. We have also Fiona, Marion, who is a student research assistant, Ashley, who is from Partners for Care, and Rose from Mount Kenya Universities. And of course, we also want to appreciate Tarore's network of engaged universities and Open Society University Network for giving us finances to carry this work. And also the Laikipia County Government, where this research work was done, because they allowed us to do this study. Thank you so much. And I stop there.
Thank you so much, Peter. I'm always inspired by your work, and I'm sure you'll be inspiring many people in many parts of the world. Martina, I believe you're next.
You see my screen, everyone? Can you hear me?
Yeah, perfect, Martina.
Right.
Thank you.
Right, I'm going on then. Good afternoon or good morning. I'm Martina Jordaan. I'm from the University of Pretoria, and I'm representing our team, Reverend Chris Nkomo, Mufana Matibela, and Obed Mahlangu. And I will discuss the project that we are doing with the Historical Society of Mamelodi. So my brief of my discussion will be the following. I will first, let me just do this. I will first tell you a little bit about the University of Pretoria, and then a little bit of background about the community we are working in. In the Historical Society of Mamelodi, I will reflect on the project, what happened throughout the year, and then the way forward. So the University of Pretoria has a number of campuses, and I'm situated in the Mamelodi campus. It's one of the campuses. It's situated in Pretoria in South Africa. So the University of Pretoria got 9 campuses, and this one campus that we are working in from is situated in a township, Mamelodi, east from Pretoria. So it is very ideally situated in the township because it's sort of next to the informal settlement. And we can really work very well from the area. Now, the Mamelodi campus, University of Pretoria, got an anchor strategy agenda and see it as a social innovation hub. On the campus, there's an animal health clinic, a clinic for occupational therapists, a business hub, and then students from various courses such as engineering, theology, psychology, health are involved in various projects on the campus. And the campus also partner with local NGOs, the city of Tshwane, that's the broader area of Pretoria, the education department, as well as a number of international partners. The US Embassy, for instance, also has a library on the campus and provide various projects for secondary school learners. Now, the campus also in the process develop other partnerships. So because it sees itself as a social innovation hub, there's a number of partners it's working with. So the business hub has a vegetable garden where they train entrepreneurs. There's a sensory STEM garden that was established in collaboration with the engineering students and the architect students and the occupational therapy students. And this garden is used as a training center for the early childhood development practitioners. The Needlework Ladies is also incubated in the campus and do also social entrepreneurial projects. And there's a music project for that empowers learners to play various musical instruments. And then, of course, the tape aid for the blind is also on this. As part of this, lots of various outreaches and projects, we also now are partnering with the Historical Society of Mamelodi. The main aim of the Mamelodi campus is educational pathways. So we work very closely with the early childhood development centers, the primary schools, the secondary schools, and on the campus, the extended curriculum programs are presented for students to get a chance to reapply to the mainstream on the Hatfield campus. So to understand the logistics of Mamelodi, it's important to understand where we are and what's happening here. So we are situated on the east of Pretoria. That little blue area is Mamelodi. And it's one of the 8 townships around Pretoria. Now, townships were created after the Groups Areas Acts in 1950. With the beginning of apartheid, and Mamelodi was designated for blacks only, the area under this apartheid government. So it's mainly in 1952, people were forcefully removed to be resettled in Mamelodi, and you can see the houses that were provided to them. So it's mainly African people living there, and then also the local language that people speak is Bukedi, even though they create their own new language, a mixture of all sorts of language that they call Pretoria. There's about 56 schools. They are extremely proud of their soccer team. The community is very diverse, as you can see in housing. And that is one of their favorite dishes called a spatlo. So the Historical Society of Mamelodi is situated in the township, and it comprises of people that's very passionate about the conservation of the stories of the community of Mamelodi. And they all do have a deep understanding of the dynamics and the history of the community. Our main aim was start capturing the stories digitally and not so much in a book form or create an archive or something, but start capturing the stories. So the first part of the project and what we actually got the grant for was to do digital storytelling where people create their own stories. So that was really successful. People started attending this because it's a skill that they learn how to use this cloud-based video editing software. Then there was a request from the community that they want to do research workshops. And it was presented by the Department of Informatics. Now it's included in the digital storytelling training. And then we realized there's a lot of senior citizens that really want to share their stories, but not able to maintain the trainings to create their own stories. And Reverend Chris and I are now visiting them, and we are interviewing them and uploading their stories. Out of this also, we develop a project with the Department of History and Heritage Studies, where the students then develop story maps on the history of Mamelodi. That was really exciting. So the first part of our project that we did a webinar and reflecting a little bit on our experience and what we are planning to do. And we created a website so that the digital stories and the story maps are available and reachable for the broader community. The videos are shared on a YouTube channel from the Historical Society of Mamelodi. And we also shared the same videos on the Mamelodi campus YouTube channel. So it is available on various formats. We also started a LinkedIn profile this past week, so share our stories more. The story map project was very exciting for us. We found out about a software called Story Maps, and we actually contacted the history department and suggested that the students work with the Historical Society of Mamelodi on a specific project where they can create story maps. So with the students and the community partners, the students identified 4 themes that they would address. The first one was events and sites in Mamelodi. Group 2 worked on life in Mamelodi. Group 3 on famous people of Mamelodi, and Group 4 on education in Mamelodi. You can see the community partners with the students. So because the students are not from Pretoria, they were all taken through a tour through Mamelodi, where these community partners were the tour guides. It was so successful that we now use the Historical Society of Mamelodi's members as tour guides for any other visitors that we do get to Mamelodi. The software that we use was actually available on the campus, the license. We were very excited about that. And the idea was that each of these groups will now create a story map. This we did in partnership with the Department of Geography that had them licenses, and the community partners with the students attended the training on developing the story maps. And at the end, they used this digital a capability lab of the Department of History and Heritage Studies to develop these story maps. What's so exciting is that the story map is actually built around the Google map, and you can pinpoint in the map of Mamelodi where certain things happen. This is the example of the educational story map students developed. So the assignment was the students and community partner must decide on at least 5 points on the Google map. And then they also had to include 1 interview with a specific community partner on this topic. This was Mr. Seboni, that was very high in education, and he reflected on his role in education. At the end, the story maps were published, and the community partners were co-assessors for the students to decide what will be their marks. That was very exciting that our original project actually developed onto that. So I will reflect a little bit on my own experience that I had in this process. So originally the plan was just to do a digital storytelling course and then ask people to create their own videos. First of all, it was very exciting to see that people that actually don't have computer skills were able to develop their own stories with the software, because they actually only needed to click and drag, and that they had the opportunity to tell things that they perhaps didn't share otherwise. We also didn't realize the great need or interest in desktop research. It was really a fully packed classroom, and we are planning a second session on desktop research, and the interest that people had to do research on various aspects. And then the value that we had now, that Reverend Chris, that's in the session, and I experience when we are interviewing senior citizens. A lot of them shared that they would like to tell their stories to the kids, but the kids is not interested at this stage, but they believe if they have it on record and they can share it with their kids and their family members, it will be not get lost. I was also very impressed with the story map process and the involvement of the students with the communities members to develop the story maps. That was a very, very exciting project for us. The students reflected as follows. They enjoyed it to work with the community members. They all honor students that's doing tourism, and they saw the value that they must have a very good link with a community partner if they want to do a successful tourism business one day. They also, of course, reflected that they were more aware and knowledgeable about the history of Mamelodi. And then they used different software that includes the story map software. And I gave them also access to the cloud-based video editing software that we use for the digital storytelling. And then the value of the digital capability lab that was newly established was wonderful to work on a place where students could work with the community members in this very exciting space. The Historical Society members reflected various things. For them, it's not very exciting to work with the higher education institution. There's a lot of new skills that's developed. They learn a lot of computer skills, video editing skills, research skills, and people are very enthusiastic about that. They get more exposure with the webinar lectures. They had to lecture the students. We are going to attend a conference together, and through this, we created new networks and new opportunities that we are very happy about. So what will we do from here? We will publish an article, attend a conference, and then we'll definitely continue with the projects. I think this just got now momentum and we don't want to stop. It's very important that the secondary school learners get involved in this project, that they understand the value of the history and how to preserve it. And we actually went onto the portal of digital stories and the digital world, because we know the learners or the kids will be more inclined to watch a video than read a book. We also would like to involve the primary schools, because local history is involved in the primary school syllabus, and it's very difficult to find any information about Mamelodi. So I would like to thank my researchers. It's a wonderful, it became a deep friendship between us. I think that is the most valuable thing that I had the past year. Reverend Chris said to me yesterday, "You are happy, you're enjoying this." And I said, yes, that's how it is. So I hope you can ask me any questions then after Joseph's presentation. Thank you.
Thank you so much, Martina. It's always a pleasure to learn more about your work and to see how your work is evolving over time. And we really appreciate your presentation. I think I'll ask that we hold all of the questions until the end. We'll give Joseph a chance to connect and present, and then open up for questions. Joseph, I think you're next. Are you ready?
So I am Joseph, and I work at Livingstone International University. So sorry, my PowerPoint is a little stuck. Yes, so I'm joined by Martha Awati, one of my students, who is a volunteer in the current and ongoing research project. So this is Martha. Maybe you can hear her say hi, because the video is kind of disturbing. Martha is right here with me.
Hi, members. Good afternoon.
Yeah, it's morning the other side. So I will present first, then Martha will join in after me. So we are presenting on financial literacy in the North Bukedi sub-region of Uganda, access to education. Now, Livingstone, where I work, is a private Christian university in Uganda, and the motto is building nations of Africa. And the vision is ethical, empowered, employable Christian leaders in every sector of society. I happen to be a student in this same university before I was retained to continue working with the university. So the research project we are working on is opportunities for village savings and loan associations, and in Budaka district, Bukedi sub-county, and they were supported by Taloris and OSU. Now the project is still ongoing. We are still collecting data. We have had a few challenges here and there, but I think by the end of this month, we'll have some results to share. North Bukedi is a sub-region in eastern Uganda. It covers the districts of Palisa, Butebu, Chibuku, Taleja, and Budaka. It is the second poorest region in the country after the Karamoja sub-region. That's according to the Minister of Science and Technology and Innovation Minister of Science, Technology and Innovation in Uganda. The domestic violence rate in the region is 48%, according to UBOS. And in Uganda, the multidimensional poverty level is 47% of the population when we look at both monetary poverty, education, and basic infrastructure services. Now, this particular region, while the national average is 47%, this particular region where we're working from has 78%, which is quite too high. And in the region for the children below 18 years, it's 83%. Now, financial literacy relates to making informed financial choices. And this includes savings, investing, borrowing, and so many other decisions. And to be financial literate, we focus on the knowledge that someone has financially, the attitudes towards finances, and their behavior. Because these key areas influence the choices people make on financial products, services, and other plans in life. It is estimated that at a global level, 33% of adults are financially literate. That means that the balance of the global population is actually financially illiterate, so they can't make informed financial choices. And Africa scores the worst average, with Somalia being the least financial literate with 15%. Uganda is rated to have 34% level of financial literacy. And you will find that in North Bukedi itself, there has not been any specialized study to establish the level of financial literacy. But if Uganda is 34%, it means that normally what I've seen is that when Uganda is at 50%, North Bukedi is at half level. So you could say that that's 34%, you divide it by 2, that is what is happening in North Bukedi. Now, we asked the students and staff of Livingstone and some of the former alumni who studied at Livingstone, because Livingstone is in North Bukedi. So their experiences for the years they are here, actually in North Bukedi. So they suggested that financial literacy skills are obtained in school, according to their experience, mainly school, social media, others say newspapers, and the least percentages are on parents from the bank, employers. So you discover that growing up, most parents don't teach their children in Africa about financial literacy, or they don't discuss money. That's what we are seeing. Now in North Bukedi, only 0.9% of the total population has a university degree and above. Majority of the populace has not completed primary school, as we can see with the 49.4%. So many of the people in North Bukedi are not like literate in terms of education. And so now we have a population that is not generally literate in their education, and they are not also financially literate. So when we asked the staff of Livingstone and the students and alumni that if a family loses the main source of income they have, maybe a job, agriculture, or anything, how long can the family continue to sustain the education of the dependents or whoever is supposed to benefit from family. So on average, only 21% of those who responded can have their family sustain the education of their children or any other people who should benefit from the family for more than 6 months. Majority of them say that they cannot go beyond the 6 months if they lost their main source of income, meaning they don't have savings that can sustain the family for more than 6 months. They don't even have investments that can help them. Now, it is reported that multi-dimensional poverty is highest among households where the household head has no formal education in Uganda. And just imagine the whole of North Bukedi, there are just quite few people who have gone to school up to certain standards. Almost half of the whole region not having managed to go through primary school successfully, and they don't have financial literacy skills. So you find that the heads of those families cannot make good financial decisions. And so you get the whole of the region in multi-dimensional poverty to the level that life is so difficult. Now, this trend is going to continue if no objective interventions take place. And because of that, I personally thought that to be good reasons for me to start investigating and doing research in the area of finances. So we started to look at savings associations, because that's where you can get all this, most of the people in this region to discuss these things. So it has not been easy. Approvals from government and then partnerships that are quite difficult, but we are going to progress well and we will have findings. Now, one of the good things that we're happy to register is that Martha, being one of the students in my class, was able to establish a student circle last year, and she's going to present to us what is happening in that circle. So this small circle is like a model of what is happening in the communities. They have those circles where they try to save money, they lend each other, and then they see how to help themselves grow. So Martha, you can take over.
Thanks very much for the opportunity. LIOs stand for Livingstone International University. It's a student circle. This circle started in October 2022. So we have so far registered 20 members. And the course mix that we have the School of Business, the School of Information Technology, Education, the School of Media Technology, and Christian Ministry. So why this LIU circle? It's majorly like many students were struggling with the tuition, had dead semesters, dead years, or most of them even dropped out of schools. So far, what we have achieved is we have, number one, increasing the membership from 5 to 20 members. So the mobile money account for the circle so far we have opened, and then there is good networking among the members. Saving skills also developed among the students. And then we have informed borrowings in terms of loans. And finally, we have the circle saved students from dropping out of school or missing exams. So since we started this circle savings at the university, most of the students who were really struggling with the education, the tuition fee, were able to help themselves, borrow money from their association and paid off their school fees. And I happen to be one of the members, the students who succeeded from that SACCO savings. So much as we are trying, but we also have some challenges that are really watering our organization. So some of the challenges we have are the limited technology to run our SACCO activities. We also have inadequate finances due to low share acquisition, less savings, time limited also due to class schedules. Most of the students are unable to either attend our meeting or commit themselves to the SACCO. There is also difficulty in winning new members or students whatsoever in our SACCO. And then we also have less female membership with our organization. So our next plan actually, if God gives us the opportunity, we need to embed technology in all our processes, network with the community in Eastern Uganda to improve other SACCOs as well. We also need to enroll the staffs, the university staffs, the alumni and community members in our SACCO. We also wish to open up our bank account and then open up ventures, and then also conduct these community outreaches and in trying to support the communities out there on the knowledge of savings.
Martha, being one of the brilliant students in my class, decided, actually, I used to share with her. She used to come to me, tell me, sir, I am not sure if I'm finishing this course. So you see, now you lend me some money, I pay school fees. And I used to tell her that you need to do something about it. So she decided to start her own SACCO, which is some kind of like in form of a VSLA. But this one particularly is for students at campus. So students come together every week, they save their money, and then those who are lucky can borrow. So it means that if a student at the end of the semester has not been able to pay all the tuition, they can borrow from SACCO so long as they're a registered member. They pay tuition, they do the exam, they go home, continue working hard as they pay off the loan from SACCO. Now, the encouragement is that these students, apart from borrowing that money to just help themselves meet school requirements, the encouragement is that they need to borrow. Actually, I think they're around 2 now, 2 or 1, 2. They have businesses, so they borrow money to run their businesses. So those businesses are the ones helping them now to pay tuition. So one thing that is there is that most of the SACCOs, so far from the interaction in the villages and the associations that people come together to save every week, they save majorly for Christmas, those other things, and so forth. They are mainly for these other social activities. Now, the SACCOs are not specialized. So there are no SACCOs that are specifically for education. So we are looking at encouraging SACCOs or the village savings and loan associations to come together purposely for education. So you have people in the village, they have a savings group where they can put in money, they borrow to pay school fees for their children, they borrow to buy, to meet requirements of school so that their children can stay at school. So one way we are doing this is by first strengthening this SACCO at the university where students are working hard. And then those students who are members of the SACCO are going to be agents. So they will help the communities to come up with similar SACCOs specifically for education. Now, it is necessary for affirmative action to come up with an elaborate and concise plan to uplift and catapult North Bukedi out of abject poverty. That's what the minister said. So a lot of initiatives need to take place if the region is going to change. And we all know a financially literate individual is an individual of a healthy mind, an individual of a healthy body, and a healthy soul. And so we need to have more individuals in the region who are financially literate. So this requires training, this requires collaboration, this requires research. And you know, we have found challenges in the research because many people are not literate. So you go to a government official to get approvals for your research project, and the government official does not know the benefit of research. So you discover that it is quite difficult. When you go to the field, you have a questionnaire. Somebody doesn't know how to fill the questionnaire because they did not even finish primary school. So then you have to ask the person, you have to first of all translate the question in local language, ask them, then you have to take yourself. So it's difficult for research to take place actually now in such community. So we need to see that these people, like the community, gets educated, they get literate so that they can be involved. So one of the initiatives that I am thinking of, actually, which is going to be like product of this study, is to have free research education. And this research education should start from when somebody goes to primary school or the moment they reach around 5 years. Because here in Africa, you will go to a research class at university. So then if somebody is not serious, they graduate when they don't know anything about research. So I feel research should start from a young age. So when a child is 5 years, you start teaching them, talking to them about the importance of research. And then the other thing is finances, things to do with innovations. For us here, you only hear about innovation and invention when you are finishing, you are studying your bachelor's degree. So these are things that are being contemplated, discussed, and I hope that the Lord will see us through. Thank you so much for listening. If there are any questions, we'll be happy to respond.
Thank you so much, Joseph and Martha, and also to Martina and to Peter. This is just a remarkable collection of efforts to work with communities, to increase access to education, to transform higher education, to be role models in your communities and within your institutions for what is possible. Through your vision and through your hope and through your courage. I just want to, express my own personal and professional appreciation for all that you're doing. It's just truly inspiring to hear from all of you. Let me yield the floor once again, but this time I invite our viewers and listeners to come forward with questions. Do you have any questions for Martina, for Peter, or for Joseph and Martha? Or do you have a question perhaps that cuts across the 3 different countries and that you'd like to have each of them answer? You can put that in the chat, or you can just unmute yourself and jump forward and ask the question. I can get us started if that's helpful. I have a long list of questions. And I want to begin just with one more comment by saying, Joseph, thank you for inviting Martha. It's really wonderful to have a student perspective and voice in the mix, because this work involves students who then, often sometimes become faculty and if not, become community members. And this is work that continues to grow and expand in ways we cannot predict. So it's just wonderful to have her voice here too. I have a question across the 3 different instances of community university partnerships and research. I would love to hear you perhaps just share briefly some insights about your partnerships. You have very strong partnerships in the community. And if you could say a few words about, the early days, when did this partnership begin? How has it grown and evolved? This is such a central component to engaged research that I'd like to be sure that we spend some time thinking about that relationship and the ways in which it might begin and how it might change over time. So if we might go in the order of presentations, Peter could get us started with a response, I think. Thank you.
Okay, thank you, Lorraine, for that question. I will address it. The way we started our partnership, especially as we started, as a university, that is Mount Kenya University, we got into a partnership with a local non-governmental organization, which is called Partners for Care. And the reason why we engaged with them is because as a university, we don't have a very strong network within the community. But a local non-governmental organization works with communities, and therefore they have a partnership with the community. They know the dynamics of the community. And therefore, as a university, we felt for us to be more effective in our community outreach activities, we need to have a partner who understands the community. So having had a relationship with the local NGO, Partners for Care, then we identified also with the issue of safe water as one of the issues that as a university wanted to engage in our community outreach efforts. And therefore we had to agree with the NGO, which community are we going to do our intervention in. And that's how we went to Laikipia, and we identified Laikipia because already we had, from our research, we knew that there are water issues. They have, there's a semi-arid area, so they have water supply issues. They also have waterborne challenges, and therefore it was a perfect place for us to go because we knew any small intervention we would do, it would make a difference. Luckily, in the Laikipia, we already had partnership with the county government officials or local government officials. And therefore, that helped us to be able to connect easily with the schools. It also helped us to be able to do our intervention without a lot of red tape, because you don't have community gatekeepers on your side. There'll be a lot of red tape from different organizations or different government entities. So the local county government officials were able to help us navigate. And because they knew we had a good intention and they knew us, so already we had relationships with them, it was easier for us to access needed schools. It was easier for us to distribute our interventions. It was easier for us to do follow-up because already we had a working relationship. I don't know whether already
Peter, you've cut off just about. Oh, there you go. You're back. Go ahead.
Okay. So I don't know at what point I got cut off, but I was saying that the benefits, I think our success or our why we're able to work the way we are working is because we have established strong partnership with community gatekeepers. In this case, these are the local county government officials, and they have helped us to remove the red tape. It's normally there when you're working with government entities, because we're able to access the needed schools. We're able to access. We're able to do impact assessment. The communities warm up to us, because when we work with these people, they know in the communities, then they know that we are there to make a difference. Thank you.
Thank you so much, Peter. Really appreciate numerous aspects of that response. And you've got some applause in the corner here too. Martina, would you please say a few words?
Yes, I would like to share. So with the Historical Society of Mamelodi, I've been working more than a year and a half, I think nearly 2 years. And if I will reflect on this, it starts from working together to becoming very good friends. And I've got Reverend Chris I asked Reverend Chris if he can reflect also. He's one of my partners and a very close friend now. And that is what makes it so special. I think that's Reverend Chris, would you like to say something? It looks as if it can't. But I think that is what making it a special relationship. And we are developing from one to the next, and every time we get more enthusiastic with everything that we start. And I think that is also helping to make other people enthusiastic in the process. So I could not imagine that it will be on this level and this deep friendship a year and 2 years ago. And that is, I think, very special.
Thank you, Martina. Joseph and Martha?
Yes, so for us, actually, the partnership has not been long. Actually, it was even difficult to get approvals, especially from the local government. Now, we have had some partnerships before, especially on previous projects, but they are not related to finances or finance. So we had a staff. I think maybe some of you or most of you know him. It's called the Fiti. So he had connections even with local government, but unfortunately we are no longer with him. And personally, I have not worked so much or for long. He actually brought me on board now towards actually when his tenure ended. And he had not introduced me to the partners we had. So now I've had to start actually moving up and down to start to engage the different partners. Like now for this study, the first partner I had actually was not, he was so busy. I didn't have time. So then I suggested that the local government gives me another partner. So we have had that. But the challenge is most of the people don't really so much understand research or research studies. So they take their time to respond, to get engaged. But I believe that since we have started, I think we are going to build more. And my prayer is that students actually get to build more partnership with the community, even more than faculty, because I mean, students, I don't know the best words to use, but the university exists for students and the community and so forth. It's not for the faculty. Faculty just supports their activities and their initiatives. So even when we talk about innovations, what such things should be coming from students, the support of faculty. Don't know whether oh, it's okay.
Thank you so much, Joseph. I see we have a question in the chat here from Dennis. Dennis, would you like to say a few more words about your question here? It looks like you're asking, how do you support a community of practice? Which may be a broader question for the Tower Network of Engaged Universities and the Open Society University Network. However, I'm not sure. So if you're able to ask or clarify, that would be helpful. If you're not able, then we can go ahead and answer that as it's framed. In the interest of time, I'll say a few words, and then if you come forward, I'll yield. I would say, oh, here we go. We have some members of the community. Okay, thanks, Caitlin. I would say from our point of view with the Tower Network, we understand the community of practice consists of individuals. And so first and foremost, we want to support individuals, but there's also this very important collective element to the community, of course. So sort of at the heart of it is providing financial support in the form of grants. I know from my own professional experience, and I think many of us on the call understand that community university partnership funding can be hard to come by. And so we want to support engaged researchers and their communities and the work that they're doing by providing financial support. And importantly, we want to provide public recognition. We want to elevate and elevate these excellent partnerships and the results you're having, and encourage and inspire others to do the same in a way that might and does ultimately influence individual institutions and the overall higher education sector. Public recognition takes many, many different forms. I think that, this webinar is one way of getting the word out and supporting the community of practice. We also have opportunities for interviews and support, elevating these different cases and partnerships. In University World News, for example, there was an excellent article published about many of the people who are involved in this community of practice. And then as a practical matter, we meet regularly in a virtual fashion. We forge strong working relationships with one another, get to know each other in a relational way, support one another. Engaged research at some institutions can be an isolating and daunting journey, and it's often helpful to have friends at home and everywhere that can, provide encouragement and support for the journey. And I just want to build on Joseph's excellent closing comment about, the purpose of institutions and faculty really are to support students. And so the community of practice, importantly, not only includes faculty, but also includes graduate students. So those are some of my initial responses. I don't know if Caitlin and Aaron want to provide a few additions or comments to what I've said about growing a community of practice, but we have another minute or so if you'd like to.
I think you explained it very well, Laureline. Thank you.
Thank you so much. Are there any additional closing comments or questions before we wrap up for the day? I will add, while you're thinking about that and perhaps coming forward, that again, we are very grateful. This has been a fantastic session. We'll continue to share it. It's been recorded, so we'll have it on our platform and we'll push it out in an asynchronous fashion. We continue to build this community of practice, meaning these relationships. This is ultimately a group of people that get to know each other professionally and, have respect for one another and support one another, and who make connections and whose lives, paths cross again and again over time. Just as an example, I've known Martina for quite a while now. And getting to know Peter for several years. Joseph is new. I know we'll continue to work together, and others as well. So it's a group of friends, a group of colleagues, and I can speak for the Tower Network and also pretty confidently for the Open Society University Network by saying that we're very committed to this area of transformation. And we look forward to working with all of you for many years to come. So thank you so much for joining today, and please be safe and take care, and know that you're supported out there in the world with the excellent work that you're doing.